Hi, it's Mike, and I'm going to do something for my diabetes channel. And I know it's going to look like we're doing our chat for Mike's life, but I want to talk today about the differences between type 1 and type 2 diabetes. And I'm going to do it backwards because type 2 is the one that everyone knows about, and such. So I want you to sit back and relax, and we'll have a nice chat. Type 2. Type 2 diabetes used to be called mature onset. It's gone through many different names. But type 2 is type of diabetes, my head's all over the place, that your body still produces some insulin. And usually people with type 2 have to watch what they eat. And people with type 2 can usually be treated with drugs. And these drugs are made from the old sulfa drugs. Who knew? After antibiotics, there really wasn't a use for the sulfa drugs anymore. So they tried them with diabetes. Good idea. But type 2, when people say, oh yes, I created my I solved my diabetes and cured it with, a special diet. And, there was no carbs in this diet. And that's how I lost the weight, and that's how I became cured. Well, those sorts of things don't work too well for diabetes type 1. But type 2, they can work, because they can work enough that if you lose enough weight, your body's insulin will be enough to take care of things. Nice thought, huh? But type 2 is usually controlled by drugs like metformin. And all drugs have side effects. But some of them even need more severe drugs, and may even go to thinking they need insulin. But all diabetes are different. Type 2, well, your body's still producing insulin, so you don't lose the weight mass. Now, type 2, if your mother and father had it, or your mother or your father had it, chances are you're going to get it. And, this is the one you really have to sort of watch where you eat. Now, the difference between that and type 1 is type 1 is really, you have to rely on insulin. Type 2, if you lose enough weight, in most cases, you can cure your diabetes. And curing the diabetes is great. There is a lot more treatment options for people with type 2. They don't have to be so picky on when they test, and but it's harder to lose weight. Now, type 2 is a funny, you know, little things can change, you know, to help you lose weight. There's special diets out there. And that's where people always say, oh, well, yeah, but my grandmother has a special diet. Or they um, show you diets and all those. That is for type 1 or type 2, sorry. You don't, there's no special diet for type 1. And I guess we should get into type 1. Okay, type 1. Now, most people where type 2's symptoms are kind of hidden for years, type 1 symptoms are pretty obvious. For first of all, you're going to notice a thirst. And it's not like, oh, well, I'm thirsty. It's get out of the way. Where's the water pitcher? And you'll go through that much water all day, every day. And then you'll start noticing that your clothes don't fit. And, oh well. Now, you start drinking and you have this insatiable thirst because your body's blood sugar level is so high that it's trying to get rid of it. And you end up peeing. And you pee. And you pee. And what happens is you are losing the sugar, or your body's trying to get rid of the sugar. I was a fat kid, and I'm a fat adult right now. But as a fat kid, I thought, the greatest thing was getting diabetes. Here I lost a lot of weight, and it went off so quickly. It was great. So, hell, why didn't I enjoy this before? There is no cure for diabetes, type 1. And type 1 is so different than type 2. Type 1, you require insulin, and you require insulin injections, could be up to 8 times a day. And you have to count carbs. However, there is a brief aside here where type 2 diabetics, if they want a piece of cake, they really can't have it. And that's where everyone goes, oh, you have diabetes, you can't have sugar. Well, type 1 can have sugar. It's not recommended that you have it every day, but, if you really want that piece of cake or that piece of candy, you can have it. You just have to know how much carbs, and you have to count your carbs. And then your doctor gives you amount of insulin which you take to cover those. So it's all good that way, I guess. But counting carbs all the time, taking insulin every time you eat, taking your blood 8 times a day, and everyone looks at you strange. When I worked with 7-Eleven years ago, I was working with a manager who walked in on me while I was doing my blood sugar and said, "Ew, what are you doing?" No, he was from a third world country, and I think he thought I was doing black magic. But that's type 1. And type 1 is the side where this could happen with type 2. But type 1 is also where you have to deal with low blood sugars. And your low blood sugars can happen anytime. It's not kind of like, oh well, today I'll have a low blood sugar. And if they happen while you sleep, sometimes you don't wake up. And it's really strange to wake up and see an ambulance attendant in your bedroom. It's unsettling, to say the most. But you've got to keep up and keep smiling. Type 1 is you're on shots straight through. Type 2, there are other options before they try insulin. But I can remember the first time I got type 1. Not the first time, the only time. But the first time I got insulin, it was like night and day. All of a sudden I had this energy. They said, oh, it's time to go to sleep. I really didn't want to go to sleep. I had all this pent-up energy. It was awesome. So I ended up watching TV for a while. And then they said, well, you got to try to get some sleep. I couldn't sleep, and every time the nurse left, I'd turn on the TV. I was in a semi-private room. But you know what? I've had some problems with diabetes over the year. Hell, I'm in this chair because of diabetes. But there have been some perks. And thinking back, well, I probably wouldn't have made it this long. But I have. So, having diabetes, it's not a great run, but at least it's allowing me to keep going. Well, have a wonderful sugar-free day, and I'll talk to you later. Bye now.